to participate in the AAC annual meeting in this year. First of all, I will show our title and the background of our topic. Our topic is Shelter Environment of Avoiding the Infectious Disease in the Event of Complex Disasters. Background of our research is following. Asian countries are risk from various emergencies and disasters. These are natural events and man-made events. If we have strong preparation and realistic plans, we can respond to reduce human sufferings. Therefore, our research goal is to know how important the timeline for evacuation is in COVID-19 environment and also consider the sanitation and shelters. I will show you a history of disaster policy in Japan. The policy is continuous from 19th century to now. Self-help, mutual aid, and public aid. It has been taken over as a main policy in disasters and any hazards. We have lots of disaster experience. Lessons learned from the damage by disasters, a policy of self-help, mutual aid, mutual assistance, and public aid was created in 1960s. We studied that the most vulnerability is small-sized long-term care facilities, people those who weren't evacuated but suffered by torrential waters. We analyzed 3 cases of group home situations. Case 1 is one-story group home for people with dementia. It was swept by muddy waters. All 9 dementia people were flooded and lost their lives. Muddy water flowed up to the highest of the ceiling, the midnight, just midnight. Case 2 is in heavy rainfall conversion to early evacuation in daytime of a group home with dementia also. All the 16 were survived to evacuate to local shelter in 2 hours because of the daytime and early information from local government and evacuation support staff were enough. Case 3 is a disaster prevention plan has been developed for dementia group home. This case is in this July. The rising water flooded to group home late at night. There were only 2 care workers. They couldn't carry out about everyone. Elderlies with dementia, all 14 were sacrificed due to the experience of the 2016 disaster, case 1. It became mandatory for facilities requiring to create an evacuation security plan and conduct evacuation drills in 2017. Unfortunately, this facility had not yet created this plan, had not also conducted evacuation drills. It was quite a tragedy case. We often have a normalcy bias that causes us to turn a blind eye to inconvenient information, like I'm okay, we survived previous disasters, therefore it's not time to evacuate, or it won't happen here. That is normalcy bias in a disaster time. Long-term care workers are busy dealing with a variety of daily works. There is still a myth that facilities are safe. Disaster that may happen someday later, not now, has become afterthought. And also people are easy to forget the experience. Long-term care facility has lots of disaster risks. I figure out minimum standards for facility in daytime and nighttime. Long-term care facility have to know the area's timeline for safe evacuations. Oh, excuse me. The timeline system has revealed prominence since 2012, when the state of New Jersey in the United States adopted a timeline for the evacuation of residents in order to minimize the damage by Hurricane Sandy, which caused extensive damage to the region. The timeline has been influenced to many of countries, as for Japan. This is a sample of timeline for preparing major disasters like flood and landslides. So finally, we should suggest measures to prevent infectious disease in shelters. The shelters must be prepared avoiding from infectious disease. This year, a new environment of shelter or sheltering environment, and the Japanese shelter environment has been changed. As suggested by the Society of Shelter and Shelter Living, masks and disinfectant solutions should be added to evacuation backpacks, and keeping social distance at shelters. This is the final presentation said. Thank you for listening and pay attention. Let's all get over the COVID-19 in good health. Thank you. See you someday later.